Creatine is one of the most studied supplements in the world, and still one of the most misunderstood. They have heard that it hurts your kidneys, causes hair loss, or that it is some kind of steroid. Others worry about water retention or dehydration. So what is myth and what is truth? In this video, we will go through the most common fears and doubts about creatine, point by point, and see what the evidence actually says. This video complements our other creatine episodes on benefits and risks, and on the 11 mistakes that waste your results. Here the focus is on busting myths and clarifying what research says about safety and use. We will cover 11 points. Water retention, steroids, kidneys, hair loss, dehydration and cramps, children and teens, fat gain, loading, older adults, types of creatine, and whether you need to take it every day first. Water retention, myth or truth? Truth, but with an important detail. Creatine can increase water retention. The key is where that water goes. Creatine works in the energy system of your cells, including the muscles. When creatine is stored in muscle, it pulls water and glycogen, stored carbohydrate, into the muscle tissue. So the water ends up inside the muscle, not in the space between skin and muscle. That is why many people look fuller and more defined when they use creatine correctly. Nobody wants the kind of bloating that comes from fluid between layers. But water inside the muscle is part of how creatine supports performance and how your muscles look. So yes, creatine can cause water retention, but it is the kind that goes into the muscle, not the kind that makes you puffy if the number on the scale goes up a bit when you start. That is often this muscle water and glycogen, not fat. Second, is creatine an anabolic steroid? Myth: creatine is not a hormone and it is not a steroid. Its chemical structure is completely different from testosterone or other anabolic steroids. Steroids have a specific molecular configuration that creatine does not have. Creatine does not produce the same effects or the same side effects as steroid hormones, so you can relax. Creatine and anabolic steroids are not the same thing. Third, does creatine cause kidney damage or kidney dysfunction? Myth: in the past, some doctors believed that because creatine might raise blood creatinine, a marker often used to check kidney function, it could harm the kidneys. But creatinine in the blood can go up slightly when you take creatine simply because creatine is metabolized to creatinine. That does not mean your kidneys are being damaged. Long-term studies in healthy people using normal doses of creatine have not shown evidence of kidney damage. If you already have kidney disease or reduced kidney function, that is different. You should talk to your doctor or a nephrologist before starting creatine. For healthy adults, the evidence does not support the idea that creatine causes kidney damage. If you have blood work done, tell your doctor you use creatine so they can interpret your creatinine level correctly. Fourth, does creatine cause hair loss or baldness? Myth with nuance. There was one study that found an association between creatine supplementation and an increase in a hormone called DHT, or dihydrotestosterone. DHT is involved in male pattern hair loss in people who are genetically prone to it. But that study had limitations. The creatine dose used was high. There was no strong control for whether participants already had a tendency to lose hair, and the increase in DHT was not necessarily enough to cause hair loss. Many things, including exercise itself, can temporarily increase testosterone and DHT without causing baldness in everyone. One study cannot prove that creatine causes hair loss. At this point, research does not clearly show that creatine causes hair loss. If you notice thinning and suspect creatine, you can stop and talk to a dermatologist. Fifth, does creatine cause dehydration and muscle cramps? Myth: creatine is not a diuretic. It does not act on the hormones that control fluid balance, such as aldosterone or ADH, the antidiuretic hormone, in a way that would increase urine output or cause dehydration. So creatine does not cause dehydration or cramps through that mechanism. Staying well hydrated is always important, especially when you train. But you do not need to blame creatine for dehydration or cramps. Sixth, is creatine harmful for children and adolescents? Myth: research suggests that in some settings, creatine may support physical and even cognitive development in children. In adolescents who are involved in sport, modest doses, for example around 3 grams per day, have been used in studies to support performance, strength, and power. That does not mean every child or teen should take it. Use in minors should be discussed with a doctor or a qualified professional. But the idea that creatine is inherently harmful to children or adolescents is not supported by the evidence. Seventh, does creatine increase body fat? Myth: body fat gain depends on your calorie balance. Whether you eat more calories than you burn, creatine has very few calories. For example, 3 grams of creatine have only about 12 calories, less than a small apple, so creatine does not cause fat gain. Any weight gain you see when you start creatine is typically from water inside the muscle and possibly more lean mass, not from fat. Eighth, is a loading phase necessary? Part truth, part choice. A loading phase exists and can work. You take a higher dose, for example around 20 grams per day, split into 4 doses of 5 grams, for about a week, then switch to a maintenance dose that can saturate your muscles faster, but loading is not required. You can simply take a steady dose of 3 to 5 grams per day and reach the same saturation over a few weeks. So loading is an option, not an obligation. Ninth, is creatine beneficial for older adults? Truth, research suggests creatine may help with sarcopenia, the loss of muscle mass and strength that often comes with age and inactivity. Some studies have also looked at creatine and brain function, including memory and cognition, and at possible links to conditions like Alzheimer's disease. If an older adult starts or continues resistance training, creatine may help support strength and function. So creatine can be very useful for older adults, not something to avoid just because of age. 10th, what about different types of creatine, monohydrate and hydrous Creapure? Creatine monohydrate has a water molecule in its structure. It tends to dissolve more easily, and hydrous creatine is creatine without that water molecule, so it is more concentrated by weight. The practical difference is small. Creapure is a well-known quality seal, a standard that certifies high purity, and many people look for it or for other third-party tested products to avoid fake or impure creatine. Whichever form you choose, prioritize quality and a trusted source. 11. You need to take creatine every day, even when you do not train. Truth, creatine has what is called a chronic effect. It works by building up in your muscles over time and staying there. If you only take it on training days, your muscle stores can drop on rest days and you lose part of the benefit, so take it every day. The exact time of day does not matter. Unlike with an antibiotic, you do not have to take it at the same hour. What matters is consistency. Every day, whether you train or not, so where does that leave us? Many of the risks people worry about: kidney damage, hair loss, steroids, dehydration, fat gain, harm to children, are myths when you look at the evidence. Water retention is real, but it is inside the muscle. Taking creatine every day and choosing a quality product are what matter for getting the benefits. If you have not seen our other creatine videos on benefits and risks, and on the 11 mistakes to avoid, check them out. They go deeper into how creatine works, dosing, and practical tips. Subscribe for more evidence-based health content, and leave a comment if one of these myths was something you used to believe. This video is for educational purposes only. It is not medical advice and does not replace a conversation with your doctor or a qualified healthcare provider. If you are considering creatine for a child or adolescent, or if you have kidney disease or other health conditions, talk to a physician or nutritionist before starting. Dosing and supplement use should be tailored to your situation. Take care of yourself and use the evidence to make informed choices.